If you have been taking insulin, metformin, or glipizide for years, and lately you feel more tired, more shaky, more forgetful, or just not quite like yourself, please hear this clearly. That does not automatically mean your body is simply wearing out. And it does not always mean your diabetes is getting worse in the way you think. Very often, the real issue is that the medicine may be controlling one number while other parts of your health are quietly being neglected. That is where fear starts for many older adults. Not from one dramatic emergency, but from the slow loss of confidence. You skip a walk because your legs feel weak. You stop driving at night because you feel uncertain. You start planning your day around meals, pills, bathroom trips, and sudden crashes. Little by little, independence feels less solid than it used to. But the good news is that your body can respond to small changes, even after 60, even after years of diabetes, and even if you have been told to simply stay on your medication and keep doing what you are doing. I am Dr. Caleb Mercer, and today I want to walk you through what most seniors still do not know about taking insulin, metformin, or glipizide. These medicines can help. They can be important. For some people, they are absolutely necessary, but they are not the whole plan. They were never meant to be the whole plan. What most people do not realize is that diabetes medicine can create a false sense of security. You may think, my sugar is being treated, so I must be protected. But after 60, protection means more than lowering glucose on paper. It means protecting your strength, your balance, your brain, your kidneys, your appetite, your sleep, your feet, and your ability to recover from ordinary daily stress. The dangerous part is that you can be following instructions faithfully and still miss what matters most. In this video, I'm going to show you 5 areas your body may need to rebuild if you take these common diabetes medications, and why so many older adults miss the first warning signs. We will talk about what to strengthen, what to restore, what to stop ignoring, and what simple steps can help you feel safer and steadier again. And stay with me, because the final point changes how many seniors should think about diabetes treatment altogether. Before we go deeper, leave a comment with your age, where you are watching from, and which diabetes medicine feels hardest to manage day to day right now. The first thing to rebuild is not your willpower. It is your timing. That may sound almost too simple. Timing? Really? But yes, for many older adults on insulin or glipizide, timing becomes the hidden hinge that everything swings on. The medication itself may not be the main problem. The mismatch between the medicine, your meals, your sleep, your appetite often is. A lot of seniors grew up with a very disciplined attitude about medicine. You take it because you were told to take it. Same dose, same routine, no questions. That mindset can be admirable. But diabetes medication does not exist in a vacuum. If your breakfast gets delayed, if you eat less than usual, if you are more active than expected, if you sleep poorly, or if you simply are not hungry that day, the effect of insulin or glipizide can feel very different inside your body. And after 60, appetite becomes less predictable for many people. Some wake up not wanting much food. Some eat lightly during the day and then more heavily at night. Some live alone and skip meals because cooking feels like a chore. Some feel full faster than they used to. Others become less thirsty and mildly dehydrated without noticing. These changes matter far more than many people realize. Imagine this. You take your usual dose in the morning. Then the phone rings. You get distracted. Breakfast happens later than usual, or it is smaller than usual. Maybe just toast and coffee. By late morning, you feel a little off. Not dramatic, just strange. Slightly sweaty. A little irritable. Maybe your hands tremble a bit. Maybe you think you are anxious, tired, or out of sorts. You sit down. You push through. But what is actually happening may be a low blood sugar episode beginning quietly, without the classic warning you expected. This is one reason older adults sometimes miss low blood sugar. The symptoms can blur into normal life. Weakness, confusion, dizziness, feeling suddenly emotional, trouble focusing, a strange empty feeling. It is easy to call that stress, poor sleep, or aging. But the dangerous part is that one unnoticed low can lead to a fall, a driving mistake, a bad decision, or a cycle of fear that makes you less active afterwards. So what do you rebuild here? You rebuild consistency around the medication, not rigidity. That means making your meal timing more dependable when possible, keeping a simple source of fast sugar nearby if your doctor says that is appropriate, paying attention to days when you eat less, and not assuming your usual dose always feels the same in your usual body. A body at 68 is not a body at 48. Kidney function changes, digestion changes, stress changes, activity changes, your response changes. Many people also do better when they stop thinking only in terms of big meals and start thinking in terms of safe medication support. What is around the dose? Did you have protein? Did you have enough food? Are you planning yard work, shopping, or a long appointment afterward? Are you more likely to drop later because you were unusually busy? These are practical questions, not medical trivia. They shape how steady you feel. And if you have ever had a day where you suddenly felt shaky, foggy, or weak, and then felt better after eating, that is not something to brush off. It is a signal. Your body is asking for a better rhythm. One helpful way to think about this is to stop asking only, "Did I take my medicine?" and start asking, "What kind of day is this body having? Is this a normal eating day, a poor eating day, an active day, a stressed day, or a sick day?" Seniors who learn to notice that difference often feel less trapped by diabetes. They are not abandoning discipline, they are becoming more observant. And observant people usually recover faster because they catch trouble earlier. Another overlooked problem is pride. Many older adults do not want to admit when a routine has become hard to maintain. They do not want to say that they forget lunch sometimes, or that standing to cook feels tiring, or that they are stretching meals because they live alone. But these details can change how a medication behaves. Hiding them does not protect dignity. Addressing them does. Real dignity comes from creating a routine your body can trust, not pretending the old routine still fits perfectly. But rhythm alone is not enough. Because the next thing many seniors need to rebuild is something diabetes can quietly steal while they think they are doing everything right. The second thing to rebuild is nutritional reserve. This is especially important if you take metformin, though it matters with any diabetes treatment. You may think of nutrition as a general wellness topic, something nice to improve if you have extra motivation. But after 60, nutritional reserve is survival equipment. It is what helps you recover from illness, maintain muscle, think clearly, protect nerves, and keep energy from dropping so low that everyday tasks begin to feel harder than they should. What most people do not realize is that some medications, long routines, and food habits can slowly wear down that reserve. Metformin is widely used, and for good reason. For many people, it is effective and well tolerated. But doctors often watch for stomach upset, reduced appetite, loose stools, and over time, lower vitamin B12 in some patients. Not everyone develops a problem, but when it happens slowly, it can be missed. Why does this matter so much for seniors? Because low nutritional reserve does not always announce itself clearly. It may show up as fatigue that never feels urgent enough to mention, tingling in the feet that gets blamed only on diabetes, a weaker grip, less stamina climbing stairs, mood changes, brain fog, a sense that you are aging faster than expected. The real issue is that your body may not be getting what it needs to repair itself well. Picture an older adult who says, "I still eat, just not much. Maybe cereal in the morning, half a sandwich later, something small at night." The scale may not even show a dramatic change at first, but muscle may be shrinking, protein may be low, hydration may be poor, B12 may be slipping. Blood sugar may still look acceptable in a basic sense, yet the person feels increasingly fragile. That is the trap. Numbers can look managed while resilience quietly falls. This is where recovery begins to look different. Instead of asking only, "What medicine am I on?" ask, "What is my body running on?" Do you have enough protein through the day? Enough fluids? Enough color on the plate? Enough nutrients to support nerves, blood cells, healing, and muscle repair? Are you assuming that because you are not overeating, you must be eating wisely? After 60, undernourishment can hide inside ordinary routines. A small appetite is not always harmless. Frequent stomach upset is not always something to tolerate forever. Chronic loose stools are not just inconvenient. They can wear you down. If food has become unappealing, if you feel full too quickly, if you avoid eating because you are afraid of raising sugar, or if your medication seems to interfere with digestion, those are not minor side notes. They are part of the whole picture. A rebuild strategy here might be surprisingly simple. More intentional protein, regular meals instead of random grazing, better hydration. Asking your clinician whether vitamin levels should be checked if you have symptoms such as numbness, fatigue, memory trouble, or unexplained weakness. Some people also do well by paying close attention to which foods upset them and whether the medicine timing contributes. And here is something deeply important. Eating too little is not discipline if it makes you weaker. Many seniors are praised for avoiding sweets, cutting portions, and being careful. Careful can be good, but if careful turns into chronically underfed, your body pays a price. Strength matters, repair matters, nerve support matters. There is also a common emotional mistake here. Some people become so focused on avoiding high sugar that they begin to fear food itself. They nibble instead of eating. They delay meals. They choose convenience foods that are easy but not nourishing. Then they wonder why they feel hollow, cold, weak, or slow. The body needs raw material to stay alive well. It needs amino acids to repair tissue, vitamins to support nerves, minerals to keep systems running, and enough total energy to prevent the body from borrowing from its own muscle. For many older adults, one of the most practical improvements is simply making the first half of the day more nourishing. A better breakfast with protein, a planned lunch instead of an accidental one, a snack that supports stability instead of just temporarily filling a gap. These are not glamorous changes, but they can change the entire emotional tone of the day. If this kind of practical guidance helps you cut through the confusion, subscribe so you keep getting calm, clear videos built for adults who want stronger years. Now let me take you to the third thing to rebuild, because this is where many people finally understand why they do not feel stable, even when they are trying hard. The third thing to rebuild is muscle and movement confidence. Diabetes is often discussed as a blood sugar problem, but for older adults, it is also a mobility problem when it is not managed in a whole-body way. If your treatment routine leaves you afraid of lows, drained of energy, or too uncertain to move with confidence, then your world starts shrinking. And once movement decreases, blood sugar control often becomes harder, not easier. This happens in a quiet chain. Maybe you had one bad episode while walking outside, shopping alone, or doing chores. Maybe you felt weak and had to sit down. Maybe nothing terrible happened, but it scared you. So now you move a little less. Then your legs get a little less conditioned. Balance gets a little less reliable. Blood flow is not supported as well. Stiffness increases. Fear increases. Then simple activities feel more demanding, which makes you even less likely to do them. What most people overlook is that muscle is not just for appearance or athletics. Muscle is protective storage. It helps your body use glucose better. It supports balance. It cushions joints. It gives you the power to get up from a chair, carry groceries, climb steps, and catch yourself when you stumble. After 60, losing muscle is not cosmetic decline. It can become independence decline. This is why some seniors say, "I take my medicine, but I still feel like my body is getting older too fast." The medicine may be helping one part of the equation, but if you are becoming weaker, less active, and more cautious with every passing month, then the broader trajectory may still be heading the wrong direction. The good news is that rebuilding movement confidence does not require becoming a fitness enthusiast overnight. It starts with removing unnecessary fear and adding structure. For some people, that means discussing exercise timing with their clinician so they do not walk right into a low. For others, it means never being active on an empty stomach if that has caused trouble before. For many, it means starting with short, repeatable movement after meals, gentle strength work, chair rises, hallway walks, or light resistance exercises that feel manageable. Imagine the difference between 2 weeks of avoiding movement and 2 weeks of doing 10 careful minutes twice a day. The second path does more than burn energy. It reminds your brain and body that you are still capable. It restores trust. It creates momentum. And momentum matters enormously in later life. I have seen many older adults assume they need to wait until they feel better to move more. But often, within reasonable safety, they need to move a little better to start feeling better. That is a very different message. Not reckless, not extreme, just honest. And if you live with the constant background fear of dropping too low, then building a more reliable plan around activity becomes one of the most powerful emotional treatments as well as physical ones. Because when fear fades, life opens again. This is why rebuilding strength should be measured in function, not ambition. Can you stand from a chair more easily than you could a month ago? Can you walk the store without that same uneasy feeling? Can you carry laundry with less strain? Can you recover your breath more calmly? These are meaningful victories. They are proof that the body is still trainable. And there is another benefit that does not get talked about enough. Movement improves self-respect. When you feel physically capable, you make better decisions. You prepare food more reliably. You sleep more deeply. You are more willing to attend appointments, visit people, and stay involved with life. In that way, strength is never just about muscle fibers. It becomes a bridge back to participation. Still, there is another reason some seniors on these medications feel unsteady, washed out, or mentally dull, and it has less to do with the medicine itself than with what the medicine can distract them from noticing. The fourth thing to rebuild is hydration and kidney awareness. This point rarely gets the attention it deserves. Many older adults do not feel thirst the way they used to. Some intentionally drink less because they do not want to keep using the bathroom. Some take other medications that affect fluid balance. Some have a stomach bug, a hot day, poor appetite, or a string of busy errands and realize only later that they hardly drank anything. Then they wonder why they feel lightheaded, weak, dry, constipated, headachy, or unusually tired. You may think dehydration would be obvious, but mild dehydration often is not dramatic. It can feel like a vague drop in vitality, and when you already live with diabetes, that vague drop can become more consequential. Higher sugar can worsen fluid loss. Illness can throw the system off quickly. Kidney function, which already deserves careful respect after 60, can be strained more easily when fluid intake is poor or when several health problems overlap. Why does this matter with insulin, metformin, or glipizide? Because your medication plan exists inside a body that depends on circulation, filtration, and stability. If your kidneys are under stress, if you are ill, if you are not eating and drinking normally, or if your body is processing things differently than it used to, the whole balance can shift. What felt manageable last year may not feel the same now. Metformin, in particular, is one of those medicines where doctors pay attention to kidney function. That does not mean most people should panic about it. It means awareness matters. It means you do not treat ongoing dehydration, repeated vomiting, severe diarrhea, or sudden illness as meaningless background noise. The dangerous part is not only the symptom itself, it is the assumption that you should just push through. Picture a senior who has had a rough week. Less appetite. Maybe a virus. Maybe it is very warm outside. A little diarrhea. Some fatigue. They keep taking everything exactly as usual because that feels responsible. But their body is not in a usual state. This is where communication with a clinician becomes important, and where self-awareness can prevent bigger trouble. A rebuild strategy here starts with respect for daily basics. Water within reach. Paying attention to urine color and frequency. Not ignoring persistent dizziness. Not assuming that constipation, dry mouth, or sudden fatigue are random. Being especially cautious during travel, hot weather, illness, or days when eating and drinking are poor. And not being embarrassed to ask whether your kidney function and medication plan should be reviewed regularly. What most seniors still do not know is that protecting your kidneys is not a side mission. It is central to protecting your future choices. When kidney health worsens, medication choices often become more complicated. Energy can change, swelling can appear, appetite can fall, recovery can slow, independence can narrow. Aging bodies are also less forgiving of neglect. A younger person can sometimes run low on sleep, fluid, and food and bounce back quickly. After 60, the same strain can linger longer. That is why small signs matter. Swollen ankles, unusual fatigue, sudden cramping, or a drop in appetite may seem unrelated. But when several of them appear together, they can point to a body under more pressure than usual. Many families learn this too late. They assume their parent is just slowing down, when in fact the person is worn down, dehydrated, or no longer tolerating the routine the way they once did. A little more attention early can prevent frightening setbacks later. That is not overreacting. That is mature prevention. If this is opening your eyes to connections you had never been shown before, give the video a like so more older adults find it early. And now we come to the fifth point, the one that often changes everything, because this is not just about taking a pill or an injection. It is about whether your entire treatment approach still fits the life you are actually living. The fifth thing to rebuild is partnership and personalization. This may be the most overlooked recovery step of all. Many seniors are still following a diabetes plan that made sense years ago, under conditions that no longer exist. Maybe the plan was built when they were working, more active, eating differently, weighing more, weighing less, living with a spouse, living alone, sleeping better, or before other medications were added. Life changes, bodies change, priorities change, but the treatment plan often stays frozen. You may think, if my doctor has not changed it, then it must still be the right fit. Sometimes it is. But what most people do not realize is that safe diabetes care in older age is not only about stricter control, it is about appropriate control. It is about avoiding dangerous lows, protecting cognition, preserving function, and matching treatment intensity to the person, not forcing the person to serve the treatment. This matters because older adults are not all the same. One 62-year-old may be vigorous, active, and managing beautifully. Another may be 78, eating unpredictably, taking several medications, living with kidney changes, and recovering more slowly from even minor disruptions. The same drug category can affect two people very differently. That is why personalization matters so much. Doctors often see patients who say, "I thought feeling this way was normal for me now." That sentence should stop us in our tracks. Normal for me now can hide medication side effects, repeated mild lows, poor nutrition, weak hydration, untreated nerve symptoms, or a plan that has simply outlived its usefulness. If you have been assuming your shakiness, confusion, stomach trouble, or weakness is just the cost of getting older with diabetes, that assumption may be stealing options from you. Rebuilding partnership means speaking up with specifics. Not just, "I am fine," or "my sugar is up and down." It means saying, "I feel weak around late morning. I am eating less than I used to. I have had 2 dizzy spells this month. My feet burn at night. I am afraid to exercise because I dropped once. I have diarrhea several times a week. I forget lunch sometimes." These details matter. They can reshape treatment. It also means understanding that targets may need to be individualized. Lower is not always better if lower comes with falls, confusion, panic, or loss of confidence. A treatment plan that looks excellent on paper but makes daily life smaller is not automatically a good plan. The real goal is not to win a number. It is to protect a life. And this is where hope becomes real, not sentimental. Because once a person understands that diabetes management after 60 should support function, not just glucose, new doors open. Meals become more intentional. Movement becomes less frightening. Symptoms get reported earlier. Medication reviews become more meaningful. Families notice patterns sooner. The person stops blaming themselves for every difficult day and starts building a system that actually fits. There is a second layer to personalization that families should understand as well. Diabetes care in later life often works best when loved ones know what patterns to watch for. Not to control the person, not to hover, but to notice change. If your spouse sees you getting quiet, pale, and shaky before lunch, that observation matters. If a daughter notices you stopped finishing meals after starting a medicine, that matters. If a friend sees you avoiding walks because you are afraid of feeling weak, that matters too. Sometimes the people around you notice the pattern before you do. This does not mean handing your independence away. It means protecting it with better information. Independence is strongest when it is supported, not when it is isolated. Many older adults have spent a lifetime taking care of other people. They are not always comfortable being observed or helped. But accepting useful support is not surrender. It is strategy. And let me say something else that many seniors need to hear. If you need your medication, that is not a failure. If you need insulin, that is not a moral defeat. If metformin helps you, that is not weakness. If glipizide has been part of your care, that does not mean you did something wrong. Shame has no place in chronic disease management. The question is not whether you should feel proud or embarrassed about the medicine. The question is whether your current plan is helping you live as safely and fully as possible. That mindset changes everything. When shame leaves the room, better questions enter. Is this dose still right for my routine? Are my meals too inconsistent for this plan? Should I ask about low blood sugar risk? Are my stomach symptoms worth mentioning? Should someone check whether tingling in my feet is only diabetes or also something else? Would a different schedule improve my mornings? These are strong questions. They move care forward. And forward is exactly the direction I want you to remember today. Many seniors think diabetes treatment is only about preventing disaster. But good treatment should also help rebuild ordinary life. It should help you wake with more confidence. It should help you enjoy meals without guessing. It should help you move without constant worry. It should help you preserve the simple freedoms that make life feel like your own. One more reason personalization matters is that symptoms do not always come from one source. A senior may say, "My feet tingle, my sleep is poor, I feel weak, and I cannot tell whether it is my age, my diabetes, my medicine, or something else." The honest answer is that sometimes it is a mixture. That is why a rushed appointment can miss what a careful conversation catches. Tingling may be worsened by blood sugar, but it can also overlap with low nutrient status, poor circulation, inactivity, or simply the fact that symptoms have been allowed to progress too long without being described clearly. The same is true for mental fog. An older adult may fear the worst when concentration slips or memory feels off. But sometimes the body is signaling instability, not inevitability. Repeated mild lows, poor sleep, dehydration, not enough food, and general weakness can all make thinking feel less sharp. That does not mean every cognitive change is explained by diabetes medication. It means you should not assume the answer without looking at the pattern. This is why writing things down before appointments can be so powerful. When do symptoms happen? Before meals? After walks? At night? On days with poor appetite? After stomach upset? A simple notebook can reveal patterns that memory misses, and patterns are where better care begins. Once you can say, "This happens 3 mornings a week around 11, or "My legs feel worse when I barely eat breakfast," the conversation becomes much more useful. Vague suffering becomes actionable information. That shift can be powerful. Instead of living under the constant shadow of what might go wrong, you begin to notice what can improve. Fewer crashes, better mornings, stronger legs, clearer thinking, less fear leaving the house, more confidence saying, "This dose, this timing, this routine, this symptom, we need to talk about it." That is not being difficult. That is being wise. And remember, recovery rarely happens in one dramatic leap. It often begins with one safer breakfast, one more glass of water, one better question at an appointment, one short walk after lunch, one moment of honesty about a symptom you kept minimizing. Then your body responds. Not all at once, but enough for you to notice. A steadier afternoon, less trembling, a clearer head, a little more trust in your own legs. These are not tiny things. They are the early signs that your system is being supported instead of merely medicated. When seniors see that improvement is possible in real daily life, motivation changes. They stop chasing perfection and start building stability. And stability is what gives you back confidence, which is often the very thing diabetes quietly tries to take away. That is how small changes become protective changes when they are repeated long enough for the body to relearn steadiness again. When you step back, a larger truth comes into focus. Insulin, metformin, and glipizide are not just medicines. In later life, they become part of a living system that includes appetite, hydration, muscle, balance, digestion, memory, kidney function, routine, and confidence. If you treat only the prescription and ignore the person taking it, you miss the very thing that determines quality of life. So let us gather the rebuild path clearly. First, rebuild timing, because a good medicine can feel unsafe when meals and doses drift apart. Second, rebuild nutritional reserve, because a body that is underfed cannot stay resilient. Third, rebuild muscle and movement confidence, because strength is one of the best forms of protection you have. Fourth, rebuild hydration and kidney awareness, because stability depends on more than the glucose meter. And fifth, rebuild partnership and personalization, because the right plan for this season of life may not be the plan you were given years ago. None of this means your medication is bad. None of it means you should stop something on your own. It means you deserve a fuller conversation. You deserve care that sees the whole picture. And if you have felt discouraged, remember this. Decline is not the only direction available to you. This video is educational, not personal medical advice. If you have diabetes, take medication, or monitor specific numbers, discuss changes and troubling symptoms with your own clinician. Your body is still listening to what you do each day. Give it steadier timing, better fuel, safer movement, enough water, and honest medical conversations, and it may answer with more strength than you expected. Please share this with a parent, spouse, sibling, or friend over 60 who takes diabetes medication and deserves safer guidance, steadier days, and more confident years ahead.